Hello, today I'll be talking about the skills of grading and estimating a pitting edema. First of all, what is edema? Edema is a swelling that is caused by a collection of fluid in your extremities. Usually, when we're talking about cardiac patients, it is the lower extremities, the legs and the ankles. So the difference between an edema and a pitting edema is when you press on the skin of the patient and there's a depression or dimple left behind by the pressure that is caused by your finger. Now I'll be talking about how to grade a pitting edema. There's 4 stages when you grade a pitting edema. The first stage is when you make a depression in the patient's foot or whatever area the edema is present, and the depression is 2 millimeters deep. However, when you release the pressure, the rebound time or the time the depression comes up is immediate. That's the first stage. And then the second stage is when you make a depression and the depression is 4 millimeters deep and the rebound time is up to 10 seconds. So from maybe 5 seconds to 10 seconds, and that's the second stage. For the third stage, the depression is 6 millimeters deep and the rebound time is up to 15 seconds. For the fourth stage or the final stage of the pitting edema, the depth of depression that is made is 8 millimeters and the rebound time is more than 15 seconds. Now I'll show a demonstration of a patient with the first stage of a pitting edema. First, when you're checking for pitting edema, you should do basic hygiene processes, wear a glove or use some hand sanitizer, and then you ask the patient for consent. Hello, I'm your nursing assistant today. I'll be checking your leg for pitting edema. Is it okay?
Yes.
Okay. So the patient should be lying in a supine position where the legs are like this, and then you should put the patient's clothes up, and then usually pitting edemas are bilateral, but it can be unique to each leg. But I'll be checking bilaterally. So you press on the patient's leg and you release it. And you can see that this patient doesn't have a dimple that is remaining and the rebound time was immediate. So the patient has a grade 1 pitting edema.